central nervous system, mainly the brain, spinal cord, and also the optic nerve. The immune system basically attacks the myelin sheath, which is the protective covering around the nerve fiber. This process, known as demyelination, disrupts the normal nerve signal transmission, leading to symptoms such as numbness, vision problem, muscle weakness, and also coordination difficulties. Sclerosis symptoms can vary widely among the patient. Early and accurate detection is essential. So, detecting multiple sclerosis early allows the clinician to start the treatment sooner, slowing the disease progress and preventing a permanent neurological damage. That's why we use MRI. MRI is the gold standard imaging tool for diagnosis and monitoring multiple sclerosis. It provides a high-resolution, radiation-free image that allows the doctor to visualize the characteristic white matter lesion in the brain and in the spinal cord. This lesion represents the area of demyelination and inflammation. MRI is also used to track disease progression by comparing change in the lesion size, number, and intensity over the time. However, in the early stage of multiple sclerosis, detecting the lesion can be difficult. Early lesions are often very small or appear similar to change caused by another normal aging or other disease. Even for experienced radiologists, differentiating the early multiple sclerosis lesion from normal brain tissue can be challenging. This is where artificial intelligence plays an increasingly important role. AI-assisted MRI analysis uses an advanced algorithm, especially a deep learning model, to automatically detect, segment, and quantify multiple sclerosis lesions with a high accuracy and consistency. Manual interpretation, which can vary among the radiologists, AI system provide an objective and equality result. One of the major problems in multiple sclerosis diagnosis is a delayed detection. Studies have shown that the average time for the first symptom to confirm multiple sclerosis diagnosis can range from 2 to 3 years. This delay often occurs because of early symptoms such as fatigue, numbness, or blurred vision are non-specific and may be mistaken for other conditions. Unfortunately, during this period, irreversible neurological damage can already occur before the treatment begins. The challenge is the presence of subtle lesion in the early stage of multiple sclerosis. The lesion may be small, diffuse, or located in anatomically complex areas such as the brainstem or spinal cord, where they are difficult to visualize clearly on a standard MRI sequence. This is further compounded by the increasing workload of radiologists worldwide. There is a growing shortage of trained neuroradiologists, while MRI demands continue to rise. This heavy workload increases the risk of fatigue-related error or misfinding, especially in a subtle case. AI can automatically detect and quantify multiple sclerosis lesions, helping the radiologist identify a subtle abnormality faster and more consistently. This improves the diagnostic accuracy, reduce the interpretation time, and also support early intervention, which is critical for preventing permanent neurological damage.
Wondering what our innovative solutions are? At the core of our technology is our AI-powered MRI diagnostic platform, a deep learning system designed to automatically detect, segment, and classify early multiple sclerosis lesions in brain and spinal cord MRI scans. This system is built not only to accelerate interpretation but to elevate diagnostic accuracy from the very first scan. Next, we offer predictive and longitudinal analysis, a powerful capability that tracks lesion changes over time to identify disease progression or relapse risks before clinical symptoms worsen. This allows clinicians to visualize subtle changes across multiple MRI studies and detect early indicators that would otherwise remain unnoticed. Finally, our solution integrates decision support, which provides neuroradiologists with lesion maps, quantitative metrics, and confidence scores, which enhancing diagnostic confidence and efficiency. By presenting objective, structured insights, our platform helps clinicians make clearer, faster, and more precise decisions. Let's discover our services. Our system directly supports early diagnosis by offering specialties to detect demyelination patterns before clinical symptoms progress. It also provides neurologists with clear visualization comparisons across time, and also improve diagnostic confidence and enable timely treatment planning. These features help clinicians intervene earlier with greater certainty. Moreover, our advanced processing layer delivers a powerful suite of capabilities. Advanced AI algorithms detect subtle brain and spinal cord lesions often missed in early multiple sclerosis. It also performs automated lesion mapping and quantification, providing objective and reproducible results that reduce variability between scans and readers. In addition, the system offers seamless integration with existing MRI scanners and PACS system, allowing immediate adoption into current clinical workflow.
Furthermore, the system can produce automated diagnosis reports within minutes. Once the MRI scan is uploaded, the AI will quickly analyze the image to detect the multiple sclerosis lesions, measure brain volume, and assess the disease activity. And it generates a detailed report for the radiologist, helping them make faster clinical decisions. This is not only save times but also improve early detections of multiple sclerosis, which is very important for better patient outcomes.
AI-VORA brings advanced AI precision to MRI interpretation. Our system helps clinicians detect early MS patterns earlier, faster, and with greater accuracy. The MS imaging market is valued at 2.1 billion, and AI in neuroimaging is projected to exceed 5 billion by 2030. The need is real and the demand is growing.
Our primary target is neurology clinic, radiology centers and diagnostic imaging providers, and also healthcare administrators. For the secondary target is neurologists, radiologists and general practitioners, healthcare insurance companies, and also research institutions.
Our direct competitors is the other groups of the semester 5 HS242. Meanwhile, the indirect competitors is the other companies such as Siemens, Philips, K-Stream, Samsung, and even United Imaging.
We maintain an active presence on social media where we share product updates, clinical insights, and breakthrough in MS research. Follow AI-VORA to stay connected with the latest in early MS detection. Our marketing approach focuses on education and collaboration. We host webinars, case discussion, and conference sessions, and we develop strategic partnership with neurologists, imaging networks, and MRI manufacturers to strengthen trust, improve workflow integration, and support real-world clinical adoption. Our annual subscription plan priced at Rm30,000 per year includes full access to the AI software, automatic features updates, secure cloud storage, and dedicated technical support. This plan is ideal for clinics and imaging centers seeking reliable, continuous AI assistance in MS detection. For institutions looking for a long-term integration, we offer a lifetime licensing plan at Rm150,000. This provides permanent access to the software with free updates for 5 years, with ensuring stability, consistency, and a long-term value.
Now moving on to the financial aspect of our AI-VORA company. So these are our key cost components. The main one-time cost is 300,000 for the research and software development, and it followed by 20,000 for regulatory approval. So other than that, we have an annual expense include the cloud hosting, maintenance, technical support, and marketing, and it totaling around 100,000 per year. So our all total cost is around 420,000 that include the one time, and if the total cost for the annual only is cost only around 100,000. Next, our revenue projection show how strong the potential of our financials in the future. So in the first year, we expect around 540,000 in the revenue from 10 hospitals reaching a break even within the same year. And by year 2, revenue increased to about 1.2 million with a growing adoption of both annual and lifetime plans. So this projection demonstrates that AI-VORA is not only technologically innovative but also financially sustainable in the long term.